So now we've completed the exam of the abdomen. We're going to move a little bit further down. I'm going to palpate for the arteries in your groin area and also check for lymph nodes down there. Again, it's important for the students to make sure that they pay attention to the patient's modesty for this. What I'm going to do is sort of bunch up your gown here, Nancy, between your legs. So I just expose the area that I'm interested in. I'm going to palpate for your femoral pulse. Good. I'm going to also then feel for the lymph nodes in this area. And I don't feel any abnormal lymph nodes. Come over to this side here too. Same thing, kind of bunch up your gown here. And there's your femoral artery. It feels normal. I palpate for swollen glands, both the horizontal group and then the vertical group. And I don't feel any swollen glands. I'm going to next listen to the femoral artery too with my stethoscope. Let me identify it again here first. Okay, and then the same thing on the other side. Good. Now I don't hear any abnormal blood sounds from the femoral artery. Now we're going to move to the lower extremity examination. And the first thing that I want to do at this point is to look for edema in the lower extremity. What I'm going to do for that is I'm going to take my thumbs and press somewhat firmly against your shin, Nancy. I don't mean to hurt you. What I'm trying to do is to see if there's any fluid that's collected in your legs. That it always collects in the most dependent position. And sometimes the doctor, if there is fluid, they can actually see it in indentation. But it's always good also just to run your fingers over an area where you press to see if you can feel it, but you don't see it yet. And I don't detect any fluid in your legs. I'm going to next check for the pedal pulses. The posterior tibs are just behind the medial malleoli. And those are normal. I'm going to check for the dorsalis pedis pulses too. Could you lift up this toe? Okay, relax now. The dorsalis is usually just lateral to that tendon. That's normal. Okay, relax your toe now. Good, and that pulse is normal too. Now I'm going to check the range of motion in your lower extremities. So again, I'm going to pay attention to the gown here and collect some of it in between your legs. What I'm first going to do, Nancy, is use your right leg. Just let me kind of be the one to adjust position. I'm going to flex the knee here. Good, and then flex at the hip. Good. And same thing with the foot. Okay, come around the other side here and do the same thing. Let me do the work again. So flex your knee and flex at the hip. And then the foot too. Good. Okay, and that all appears that your range of motion is normal too. At this point, Nancy, you can go ahead and sit up. The next thing I'm going to do is check the strength in your lower extremities. And so actually, let me just raise the gown up just above your knees here. Okay. Can you push down on your feet like you're pushing on the gas? Good. Lift your toes up towards the ceiling. Hold them up real strong. Good. Pull your legs in towards the exam table. Good. Push out against my hands. Good. And now can you lift up on this thigh? Good. Now this thigh. Good. So the strength in the lower extremities appears normal too. Now I'm going to check at sensation in all four of your extremities, the arms and the legs, okay? To do that, I'm going to again get a little wisp of cotton here, but a cotton-tipped applicator would be fine too. I'm going to do, Nancy, I'm going to touch different parts of your arms and your legs, and each time I touch you, I want you to say yes.
All right.
So can you cross your hands here?
Would you like my eyes closed?
Yes. Please close your eyes.
Yes. 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 Yes.
Okay, now I'm going to move to your legs here.
Yes. Yes.
Of course, obviously
Yes.
it's important to make sure you have
Yes.
enough of a wisp of cotton that the patient
Yes.
can detect that too.
Yes. Yes. Yes.
Good. Okay, so that sensation is intact. Next, I'm going to check for the sensation of sharp. To do that, I'm going to get a cotton-tipped applicator. I snapped it in two, so I got a little bit of a sharp edge here. And the same thing, I'm going to touch your arms and ask you to say yes each time I touch you.
Okay.
Can you close your eyes?
Yes. 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 Yes.
Okay, same thing on your legs.
Yes. Yes. Yes.
Sorry.
Yes. Yes. Yes.
Good. So your sensation of sharp is normal in all your extremities too. Next we're going to check position sense. What I'm going to do, Nancy, I'm going to hold your finger. I'm just going to move it either up or down. I want you to tell me which way I'm moving it, so close your eyes.
Down. Down. Up.
Good. Same thing on this side.
Up. Down. Down.
Okay, now your great toe here.
Up. Down. Down.
The other side.
Up. Down. Down.
Good. And that's normal. Now I'm going to check your vibration sense in all four extremities here too. What I'm going to do is set this tuning fork into vibration and touch one of your knuckles. With your eyes closed, I want you to tell me when you feel the vibration go away.
Okay.
Okay? Close your eyes.
Yes.
Feel that?
Mm-hmm.
Can you tell me when it goes away?
Now.
Good. And I'm checking myself as a control against that because I can feel the vibration too. Do you feel that?
Yes, I do.
Tell me when it goes away.
Now.
Good. Certainly the student could wait for this to go away by itself, but by kind of slowly dampening it, I can hasten the point to where I know it's going to be fading quicker. Now down to your foot. I'm going to do this by the first toe. Do you feel that?
Yes, I do.
Close your eyes and tell me when it goes away.
Now.
Okay. Same thing on the other great toe. You feel that?
Yes, I do.
And tell me when it goes away.
Now.
Okay. So all of that vibration sense is normal too.
Great.
Good. So now we're going to move to the reflex examination. And of course there's reflexes in the arms as well as the legs. So the first reflex will be for the biceps. So if you could, could adjust your gown a little bit there for me. With your arms relaxed at the side. Got my finger on your biceps tendon. Good. Come over here. Look up. A lot of times when people are looking, they contract their muscles. Okay, good. And I felt that contract. Relax your arm. Let it lay limp. Good. The other side here. Good. There's a contraction there. I'm going to check your brachioradialis here too. Okay. Just relax your arm. Good. And I felt that contraction. Lift the sheet up just a little bit. I'm going to check your knees here. Again, look across the room. Good. Okay. Check your ankle reflex. I lifted your foot so it's parallel to the floor. Good. Same thing here. Relax. Good. I'm going to tickle the bottom of your toe. And it might be a little uncomfortable, but I don't mean to hurt you. So look across the room. Okay. Same thing here. Okay. The toes are not up going. Relax your leg. Just want to flex it here once or twice. I'm checking for signs of clonus. And I don't see that. That would be another abnormal neurologic finding. Good. So the next part of the exam we're going to check neurologically is the coordination, Nancy.
All right.
Ask you to do is to put your arms out at your sides.
Straight out.
Straight out. Close your eyes and one at a time touch your finger to your nose. Good. Okay, you can open your eyes and put your hands out like this and then real rapidly tap your fingers.
Each one?
Each one, just like you're doing. Good. So again, there's normal rapid finger movement, so I know that that's normal too. Next thing I want to do is to check your coordination in your legs. What I'll ask you to do is to take your heel, put it on this other knee, then go straight down your leg. Okay, the other side, same thing. Good. And that coordination in the lower extremities appears normal too. So I think we're done with the parts of the exam on the exam table. So let me tie up your gown and back here, Nancy, because the next thing I'll ask you to do is we're going to check some range of motion of your spine here. So why don't you go ahead and stand up on the floor. And we come over to this side here. First thing I ask you to do is to check your range of motion of your spine. Can you lean forward to touch your toes? Good. So straighten up. What I want you to do is to kind of bend backwards. Good. Okay. Now tilt from one side to the other. Okay, good. Next thing we're going to test is what's called the Romberg sign. Put your feet together and then look across the room. First of all, we're going to just check how stable you can be with your eyes open, and that's normal. Now close your eyes and try to stay straight up. Okay, good. You can open your eyes. As a physician, you want to be close to the patient at this point too, in case they are unsteady. You don't want them to fall. So I'm going to ask you to walk towards the door, then walk back, Nancy. Turn around and walk back towards the Turn around and walk towards, then turn around and stop. So your gait's normal. Now, last thing I'll ask you to do is to walk tiptoe like you're walking, on a tightrope.
One in front of
one
in front of the other?
Yes, I'm going to be close to you just in case you're unsteady. Good. Okay, go ahead and turn around. You can actually have a seat on the table. And let me go ahead and wash my hands since the examination's over. Good. So, Nancy, your physical examination is all normal.
Great.
Your eyes, ears, nose, throat were normal. When I listened to your lungs, I didn't hear any abnormal sounds. When I listened to your heart, I didn't hear any murmurs or abnormal sounds. And palpating your abdomen, there was no enlarged organs. There was no lumps in the breasts. There was no swollen glands in the neck, armpit, or groin area. You got great pulses all the way down, to your arms and to your feet. And your neurologic exam is normal, too. So it's always a good idea after completed neural exam or complete physical exam to give the patient sort of a conclusion like that. Now, certainly a student can do this exam much quicker because I took time to explain each step as I was going through, and you don't certainly need to do that when you're actually doing an examination on a patient. So the only good way that a student can get better is to practice. So I certainly encourage you to practice this exam, and Nancy and I hope that this video will help you to do that. Thank you.